Last night, a new member in her first post wrote how, or a list of reasons why she was quitting smoking, but then listed one unexpected benefit. She said she wasn't getting cramps in her legs that she used to get. And she had never written the cramps off or, thought the cramps had anything to do with smoking. It's interesting, because if somebody has a cough and it goes away when they quit smoking, they kind of expected that to happen. And if they have, a sore throat or, just certain symptoms that just people seem to understand smoking can aggravate these conditions, if not cause conditions. But people wouldn't think of things often with, like, a cramp in the leg. Well, it's a problem that people don't understand that and don't think about that often. Because, one of the reasons, and a big reason that people will get cramping in legs or pains in their legs or in their extremities is because of a circulatory issue. And yet, people don't have that understanding that circulatory issues are really tied to smoking. They are tied to smoking as much as lung issues. The only difference between, like, lung cancer, and the reason the association is so strong is because so few non-smokers do get it. Some do, but percentage-wise it's low. Well, with circulatory conditions and heart disease and cardiovascular illnesses in general, non-smokers and smokers both get them, but smokers get them a lot more. And if anyone is ever having symptoms which are indicative of any kind of circulatory issue, and they are a smoker, they need to understand the implications of their smoking. One of the biggest benefits of quitting smoking will be to these people because they will almost get immediate improvements. I had mentioned, and I wasn't trying to do this in a way that I'm saying she has this condition. I had mentioned that one condition known as intermittent claudications is one that's induced by carbon monoxide exposure. Exposure that when it gets high enough will cause pain upon exertion in the legs. And smokers often get it high enough. I used to have a machine in my stop smoking clinics. Actually, we had two different time periods where we were doing testing on our people coming into the clinic. At one time, we were doing literal pulmonary function tests. I pulled in respiratory therapy from the hospital, and we did pulmonary function tests on everybody coming into the clinic. That was kind of a frightening experience for a lot of people because they didn't realize how much lung damage they did, and this was giving a screening technique of finding out, the limitations that these people had from their smoking. It was kind of a discouraging test to a lot of people because there would be some improvement when they would quit, but many of these people were really getting a diagnosis or an indicator of a diagnosis of permanent lung damage that even when they quit, it wasn't going to get a whole lot better. It'd get a little bit better. What they had left in lung tissue would work more efficiently when they'd quit, but they'd still have lung damage. So in some ways, I wasn't that thrilled with that test. It didn't give a lot of positive feedback. It alerted people that they really do need to quit smoking. They've done some serious damage here. But it didn't give a lot of a benefit by quitting. Well, the second machine we had, and we did this for a few years until the machine broke, was called the carboxymeter. We literally had people come in the first day of the clinic, blow into the machine, and it would tell us their carbon monoxide levels. And it was a test that I could repeat, and I did the fifth day of the clinic. So they came in the first thing on Tuesday, they blew into a machine, we had their carbon monoxide levels. We reported it to them, and we showed them the implications of different carbon monoxide levels. When it was around 10%, you would start having symptomatic headaches. And as you started getting higher and higher levels, the side effects and implications would get worse and worse. I mean, if it got high enough, carbon monoxide could kill the person. Now, smokers didn't come up with levels high enough like that, but they did come up with levels. Usually the group average we had was around 10%, 9 to 10%. And at that point, it's symptomatic in a lot of people. We do the test the first day of the clinic, and then we repeat the test on the fifth day. So that was from a Tuesday till a Monday. And we didn't meet on the weekends. On Monday, when people came in, the group average was generally below 2%, most people being down below 1%. They were down to never smoker levels. This was a good test. It one thing is it showed us if somebody was smoking or not, because there was nothing else that was going to shoot their carbon monoxide levels high enough to be in the smoking range. And, we would know if somebody was smoking. And I think a lot of people thought that's why we did the test, but it wasn't. I was trying to show to people, like, look how much improvement we had here, that this carbon monoxide level was down to a non-smoker's level. Now, that was crucial when you consider the implications of carbon monoxide and people who were having problems that were carbon monoxide based. Now they would not only see that the problem was generally gone if the symptom they were having was a carbon monoxide issue, they would see the measurement of why it was gone. And again, this case here where the member said, oh, she had this benefit that she didn't really even think was going to happen. Again, if it was from a carbon monoxide exposure, yes, it was going to happen. Now, the other reason that people will have peripheral vascular problems is from nicotine itself. Nicotine itself is a vasoconstrictor. So either one of these components, nicotine or carbon monoxide, and this is covered in detail in the cardiovascular video we have, and even the string we have on there about how these two chemicals work, together and independently to really cause vascular issues. So when people get that kind of improvement, make notes of that, because this is important. Because if you had a problem that was chronic before, that kind of goes away when you quit smoking. You found the cause of that problem in all likelihood. It's not saying that other issues can't come up down the line that may cause problems again in the future, but the problem you were having before was probably your smoking. If it went away as soon as you quit, well, that also means that if the person were to relapse, there's a real good shot it's coming back. Now, sometimes you would think, well, if it came back and now they recognize, so they just quit again. It doesn't work. Not in a lot of people. They're still hooked. The cigarettes are still calling the shots again. So even though they know they have this new implication to their, old addiction, that doesn't mean they're going to get off this next time, which is a reason why you want to do everything to make the quit you have going, keep it going, and also acknowledge the benefits that occur. Again, I'm not saying make up benefits that don't happen, but if benefits do occur, make a note of those benefits and be sure that, when you, try to make decisions in the future, if you ever consider taking a cigarette, that you add that into the equation of the package deal of being a smoker again. The more you recognize what smoking was doing, and the more you recognize the benefits that you can get from quitting, the more committed you'll stay to never take another puff.